So I'm Tabish Saifee. I'm a neurologist. I have a subspecialist expertise in an area called movement disorders. So that's where the control of movement goes wrong, perhaps through the brain, the spinal cord, or the nerves. And somebody's ability to control their normal everyday movement goes wrong. I see people with these conditions and help to diagnose the problem, find out where the problem is and why it's occurring, and work together with them to find the right treatment to improve their lives. I like to work with patients in a very mutual way where they can come and ask me questions. I can provide care for them. I like to think of myself as a guide to work with patients to steer them through what can be a very challenging and complex time in their lives when we're coming to a diagnosis and treatment of their neurological condition or movement disorder. So within my area of expertise in movement disorders, we use an array of different treatment options. These include medicinal options, but also I have expertise in using botulinum toxin injections to treat certain types of movement disorders. I also work with others as part of a multidisciplinary team offering advanced therapies such as focused ultrasound to help people with conditions such as tremor or Parkinson's disease. We also have other advanced therapy options, including pumps and infusions for patients with movement disorders. So I'm really excited to be able to work within the area of clinical research in movement disorders, and that is really important for me because it brings that availability of clinical research to my patients. So I'm involved in leading trials looking at novel types of botulinum toxin that can be used for the treatment of movement disorders, other types of medicines and drugs for patients with Parkinson's disease and tremor. And also I'm very interested in what's called non-invasive neuromodulation, so ways we can use treatments that are not surgical, that to non-invasively change circuits deep within the brain to improve movement disorders. The multidisciplinary team is such a critical component of how we deliver excellent world-leading care at the National Hospital. It's the co-localization of the specialties such as neurologists, particularly in movement disorders such as myself, neuroradiologists, neurosurgeons, therapists such as neurophysiotherapists, occupational therapists, psychologists, and many, many other disciplines all come together to work in a very unique way to provide the absolute cutting-edge treatment and diagnostic approaches for patients with movement disorders and other neurological conditions at the National.